Hi, everyone. This is Mayor Orman, and I'm with several people today. We wanted to give you a little bit of COVID-19 update, maybe a little bit honed into the city of Bentonville and some of our close surrounding areas. So today I have with me Michael Waddle, Dr. Debbie Jones, Brent, our Fire Chief Brent Boydston, and Denten Park with Northwest Health, and Lloyd with the Health Department. And so we're going to ask a few questions. Just to give the general public, I know you've been hearing several things in the media this week. Our governor did extend his emergency declarance till the end of the month, and so we've also heard a lot about statistics on COVID-19, and so we're going to try to answer a couple of questions and give you some of the best information we think that needs to be passed to the public and make sure it's a consistent message out there. So I'm going to start with our school district and Dr. Jones. And Dr. Jones, can you just give us just a brief update of where the Bentonville School District is and how you're dealing through COVID-19?
Absolutely. With over 18,000 students and 23 schools, I think that it is wonderful that we're still in school, and the staff, the teachers, administrators have done such good work in all the measures, mitigation measures, the cleaning, the social distancing, the face mask that have enabled us to still be here. And so on our website, we have a daily report that reports the new student cases, new positive student cases, and new positive staff cases. And that is updated daily by 5 o'clock. Today, for example, although it's a little early, we have 2 new positive students, 1 new positive staff. Just as important, and we watch this figure, are the number of students that are quarantined or isolated. Quarantine means they were probable close contacts within 6 feet for more than 15 minutes. And so today, not new, but today we had 562 students that were quarantined. That number includes those that were isolated because they're positive. We also have 33 teachers that are currently quarantined or isolated. And so we watch school by school and case by case. And as we have a number of positive cases coming in, then we kind of do a deep dive with that school. And we look at several factors. Number one, the number of positive cases active within that last 10-day period. We look at each one of those cases to determine where they contracted the virus. Did they contract that from school activities or from the classroom, anything school related? And then that's where we start becoming concerned if we see contraction within the school. If we do see that, then we have a call with the Department of Education and with the Department of Health, and we have a consult. We explain all of our data with them. We seek their advice, and we try to target the spread. And there have been a few instances throughout this school year where we have pivoted, for example, a 4th grade where the spread was contained mainly to the 4th grade teachers, and we will pivot that 4th grade home for a while. You know that we also sent both high schools to virtual the week before Thanksgiving, and that allowed 2 weeks, when you consider Thanksgiving week as well, to really clear out a lot of the cases, a lot of the quarantines, and those actions allow us to stay in school rather than continue the spread. When we see outbreaks within basketball teams or football teams, we also have to transition them. Sometimes it's sad, like Bentonville West High School football. They were headed to playoffs, and we had to end their season because they had an outbreak on the team, both among the players and the coaches. And so always our calls are for the safety of the students and the staff. And sometimes those are hard calls, but I tell you what, families, the students, and the teachers are doing amazing work. The students are wearing their face coverings. We thought that would be such a battle, and it's not, because in the end, most of those kids want to be in school every day. I'm sure it's for the instruction, but it may just be for the social interaction. So we're just thankful that we're all here.
Thank you so much for that update, and certainly pass along our thanks to all of the teachers and your staff. I really think the Bentonville School District has done an amazing job throughout all of this. So next I want to go to Denton Park, who is with Northwest Health, and that's sort of our local Bentonville hospital. I know you're part of it. You've been in contact with all the other hospitals in Northwest Arkansas, but I would like for you to give us a little bit of update about the hospital system in general, but also specific to Northwest and how you're doing.
Okay, so I think, across the region, we've definitely seen an uptick in COVID cases and in higher acuity COVID cases. So we're probably as high as we've been since our peak in July. And so obviously we're watching that very closely and want to keep a close eye on that. That puts a lot of stress on the system for the staff and for their families, and just a bunch of troopers just coming in every day and getting the job done and making a huge difference every single day. And so we're grateful for every bit of their efforts. There is some light at the end of the tunnel, and some of that light comes in the form of some different treatment plans that we have now. So we've begun to do what's called monoclonal antibody something, and it's we call it MAB, and it allows for certain people, if they attract COVID and they meet certain criteria, they can come in and we'll give them outpatient infusions that help them get where they need to be and help them recover significantly quicker. We also have the virus or the vaccine that's coming out shortly, and that'll allow us to be able to vaccinate, first and foremost, our frontline staff that's closest to patients, our medical staff, as we begin to the process of vaccinating the entire community as we move through this. And so that's a huge blessing for our country and our world as we look at the opportunity for vaccines. I'm incredibly grateful for the efforts that have been had by our school district, by our cities, by all of the people in the communities. They're doing a pretty good job. We continue to be very passionate about masking and social distancing and good hand hygiene. Because of that, we've seen less flu cases and less of those viral conditions, and that's been a blessing to the health system. We have beds. We sometimes really struggle for staff, and part of that is because of you may be a nurse that has kids who got COVID, and so obviously you're going to take care of your kids. We had some nurses who were a little bit later in their career who said, I think I'll hold this out for a little while, and so they're not working in hospitals anymore. And so I think our biggest struggle today would be just staffing effectively. But for the most part, our staff have been troopers and just absolutely amazing. Come to work every single day knowing that they're going to face some pretty difficult things, and they do an amazing job every day. And so we're grateful for their efforts. They've really done just about everything you can to keep people safe and secure. And because of that, we've been able to handle this. We work very closely, not only as Northwest Health System, but obviously Mayor and Chief Boydston. We get a visit routinely and make sure that we have not only plans, but contingency plans, and then contingency plans on our contingency plans. And so I feel like the city of Bentonville has been absolutely fantastic in preparing for what could come, and in reacting very quickly to any concerns. And I think that's why it's been so incredible here. I think some areas of Northwest Arkansas aren't quite as lucky and have had maybe a little bit higher spread. And so that creates a little bit more confusion and some difficulty. But I think we've communicated really well, been able to prepare well, whether it's the beginning of the pandemic, when things were kind of rolling out, or as we've gone throughout this, had some surges and spikes, or if it was just a necessity to make sure that we had the right testing locations. I think the city's done a fantastic job of working with all resources that are available to them to take care of the residents of Bentonville, and it's been a blessing. And so I think when we look at where we're going in the future, obviously we're going to continue to want to maintain the same level of diligence that's been had. I couldn't echo enough. Dr. Jones and her team have been amazing trying to keep kids in school, keep parents at work, and keep the spread minimized. They've been amazing. And so I think as we continue to follow the efforts that are out there, and we're going to continue to see this as controlled as possible. But I think our community can rest assured that the hospital is ready if there's a need. We work closely with our community partners. We work closely with the other hospitals in the region. And so when there's a need, we take care of those needs fairly quickly and effectively. We haven't had to ration care like we did in the very beginning when we were limiting surgeries and things like that. We've been able to move forward. And this is a unique time for people because they're a little bit concerned on what they can and can't do. And I would just say your doctor's office, a hospital are probably the safest places you're going to be. We've been practicing infection control for years and years and years. This isn't new to us. It's a new virus, but it's not, infectious disease is not new, and those practices are not new. So you're safe to go to your doctor. You're safe to go to the hospital and get any emergent or urgent conditions taken care of fairly quickly, and they'll keep you safe and secure.
Thank you for that update. And I would echo the thanks to your staff and all the frontline healthcare workers. We know it's been a challenge for them, and just thank them. And we want to move to our fire chief, who also runs our ambulance service, our EMS workers, and then maybe Michael can join in us as well, because you're working sort of with those first responders and then the pharmacies that are going to be helping to vaccinate them. So Brent, tell us a little bit, give us a little bit of an update of how we are handling COVID-19 patients and that process and where we're at.
With the numbers going up, we have seen an uptick in transport of COVID-19 patients. It all starts with our dispatch center, where they ask certain questions. And most people have been forthcoming. If they are positive and they need transported, they do let us know. We're sitting real well with our PPE right now. The guys are fully protected when they're in the ambulance with the patient. The problem comes a little bit trying to get the truck, the ambulance, the guys deconned after hauling a COVID patient in the confined space before putting that ambulance back into service. What generally took about an hour round turn for taking a patient to the hospital is now turned into about 2.5 hours. Our COVID transports are averaging about 2 a day. Our staff has been very good at staying safe. We wear masks anytime we're in the facilities in our own department. And when they're out there, they're always wearing a mask too. They might just do a little heavier protection with a known COVID patient. So we've been able to stay safe out in the public, and the people are helping us stay that way too by keeping their mask on and social distancing at the same time too.
Michael, would you like to add to that and just sort of how you're working with the pharmacies to make sure essential workers too will be in that process of getting vaccinations?
All right. Thanks, Mayor, for the invite. I really appreciate it. So I'm Michael Waddle. I'm the Director of Emergency Management for Benton County. So since the beginning of this, it's been my role to really kind of track the numbers on behalf of the county judge and kind of keep him informed, as well as fire chiefs and police chiefs as I can on any trends or patterns that we saw throughout the county. So every week I put out a little numbers report to show that growth. And unfortunately, as was mentioned earlier, we are on an uptick, and I expect that number to go up even more because we're still getting some of those post-Thanksgiving travel numbers. So when this all began, I was the one that helped work with the Arkansas Division of Emergency Management to coordinate some of the initial protective equipment that arrived in the state. Now that PPE, the protective equipment, is pretty well kind of balanced out, now I'm putting my focus into the vaccine rollout. This is like building an airplane while you're trying to fly it. Every time I'm in a Zoom meeting, we seem to have a different story. But I just wanted to let you know that this effort, at least within the state, is kind of being led by the Arkansas Department of Health, Dr. Dillahay, and we were in a telecon with her yesterday morning. And like you said, in this planning, I mean, it's a very complicated problem, if you can imagine, with multiple vaccines coming in, the amount of people that we have, and that it's a federal issue. Actually, it's a worldwide issue as far as vaccines concerned. So right now, what the Arkansas Department of Health has planned is to roll out the doses that we get, which are going to be limited at the first, to select targeted populations. And they've broken that up into phases, as you'll hear throughout. So the first group of folks that will end up getting this vaccine are the healthcare workers, as you can imagine, those frontline fighters in the hospitals. And because of the limited doses that we're going to see initially, which could start as early as next week, is what they told us yesterday, they've actually asked the hospitals to prioritize their staffing and to kind of look at their staff and look at the ones that are in the direct line, I call it direct line of combat, really, and introduce those individuals first to the vaccine before you get to your less critical staff. And then once the healthcare workers are taken care of, then they're going to start migrating the vaccine to first responders as well as long-term care facilities. So we're probably looking somewhere into an early to late spring, I would think, for the vaccine to first responders. Now, because this is such a complicated problem with numerous, there's cold storage, there's dosing requirements, there's a lot of variables at play here. So what the ADH has done is they've kind of split this effort with the local hospitals that can store the material, as well as the pharmacies across the state. So right now in Benton County, we have, I think it's 13 pharmacies that have been identified to help distribute the vaccine to our first responders and to some of the smaller hospitals and healthcare facilities once it's out there. I've already been in contact and planning with the pharmacists in this area, and they're very flexible. I think they've been actually working on this a few weeks longer than we have, because they've actually been out and contacting some of our surrounding municipalities. So I know they're on their game, and I have confidence in them for sure. So I've had, Call Your Drug reach out to us, or one of the suppliers, and they're willing to allow me to set up some sort of vaccine clinic at our public safety building and have a drive-through clinic for those first responders, or they're willing to come to you at the firehouse or the police station and do a mobile clinic. So they're very flexible.
That's one question. I don't want to interrupt, but that is one question about refrigeration. I think that's the public has been asking about. So I want to assure everyone, and I think Denten can also speak to that from the healthcare system, that I think we are set up to be able to take the vaccine in the pharmacies, as also the hospital system. And that's how this program has been set up.
Yeah,
I think it's important for people to know that this has been a long time coming. When you work in healthcare, we've known about the vaccine, we've known about the requirements for the freezers, we've known, and so we've been able to establish a fairly aggressive approach early on. We've talked with the pharmacies, and I think this is one of those things that there was a lot of work done behind the scenes before it ever got to the forefront, and so I think we're better prepared than what maybe the public is aware of. And that's not a bad thing, but we probably need to put their mind at ease just a little bit and let them know, hey, we've got it. We should be in good shape.
Right. And there's the refrigeration, they seem to have really panned out. They have all the fine details on that figured out. Where it gets a little tricky is with when they open up a bottle, they have to give the doses out, and they don't want any of this to go to waste. So there are going to be some guidelines on the numbers of people that they would like to vaccine. They don't want to do the 1s and 2s. They would like to do the 40s, 50s and beyond, get them en masse. And then from a staffing perspective for the fire and police chiefs, we don't want to inoculate the entire staff at once, because there could be some limited side effects, just like any other vaccine. So you don't want to take the chance of having staff issues, for a couple of days after. So that was something that they brought out yesterday, was to kind of stagger your staff or stagger your vaccination clinics. And I think other than that, that's all I really have at this time.
Great. And we have Lloyd Bailey on the phone with us. Lloyd, do you want to talk a little bit about the vaccines that are coming and some information about that. And then I believe also you have some materials that you sent, just some informational materials that we want to try to make sure that we get out to the public, and maybe speak a little bit to that.
You know, the first vaccine that the FDA committee had, it passed muster with them yesterday, is the Pfizer vaccine that has been alluded to in some of the previous conversations there. And as Michael had mentioned, you know, there is a phased approach that will be implemented when the vaccine becomes available, and first responders, healthcare workers are kind of at the tip of the spear with that. Vaccines are rigorously tested for safety and effectiveness, and they are not used if they are harmful or do not work. So again, it's you know, it's that first measure in trying to allay fears and concerns about the safety, you know, of the vaccine. So at the local level, we continue to assist with a lot of tracing of contacts to positives. We continue to do testing there at our local unit in Rogers and Siloam Springs. We really continue to put a lot of effort in messaging, making sure people are getting the correct information and know where to go to get that information. And again, information is critical. You know, people need to have a comfort level, and that's one of the priorities that we have, as well as providing the vaccine itself when it gets to the point where public health at the local levels are going to be involved with that. So I guess the last comment I would have would be that very thing. For the last 20 some odd years, we have practiced heavily what we call, each county has and we work closely with the local Office of Emergency Management, Michael Waddell's shop. But every county in the state has what's referred to as a medical countermeasure plan. And essentially that plan shows exactly how public health with community partners will roll out to the public at large, your population base, roll out either vaccinations, or it could be a situation where it's a terrorist event, and maybe it's not necessarily vaccinations, maybe it's other types of meds. But you have to have something in place that can reach your population base, and depending upon the issue, within a certain amount of hours. Now, as we all know in our county, I think the census projects Benton County currently to be at around 280,000 population. When we do our mass flu vaccination clinics to the public, and over the last 20 some odd years, we have practiced that plan. And traditionally, that's been a one-day event. We offer the flu vaccination to the public with no out-of-pocket expense. It's a great service to the public. We get to practice our plan. This, in some ways, is that plan brought to reality. The issue is that this is not a one-day practice event. This is going to be an event that will go on for a considerable amount of time. So we're going to have to rely very heavily on our community partners. So that's a large task, and we're just very fortunate again in Benton County to have the partnerships and the resources that we do. So I expect that when we get to that point, get to that phase, that things will go well.
Thank you for that update. And I really want to thank everybody on this Zoom call. I hope we've been able to provide some new information or some nuggets of information about COVID-19 and sort of where we're at in the process, from the school system to our health system to our emergency management. the city is always open to a question, and we'll try to connect you to the right resource. We'll, there were some resources mentioned throughout this conversation, and we'll try to make sure that we have a graphic up to direct you in those ways. We want to probably end just with encouraging everyone to keep doing what you've been doing. Wearing the mask, the social distancing, and washing the hands. That is the message that I think everybody on this call would agree that we probably can't send enough right now. And we just appreciate the public working through this with us. And thank you for joining us.